we've had up to over 30 million doses of vaccines in Nigeria. All of them have come with short shelf lives. We've been able to vaccinate over 10 million Nigerians with these vaccines that were brought with short shelf lives. When they are brought with short shelf lives, there's a subtle acknowledgement even from the donors that some of them might end up being expired. So for example, the last batch that got expired, some of them got here just 5 weeks before their expiration date, right? Now when you compute the amount of time that NAFDAC will take to make sure that they are certified, and then all of the preparations to make sure that they get into the field, little wonder that some of them will get expired. We have tried in the last few months to make sure that over 10 million doses did not expire. I think the focus really should be on the unsung heroes. Who are the unsung heroes here? The health workers who have had to work Saturdays and Sundays to make sure that vaccination all over the country continued, trying to meet and beat this deadline for this short shelf life. We're in a situation where developed countries hoarded these vaccines for several months, right? When the vaccines are produced, they have shelf life of up to 12 months. But if we are now getting them just 5 weeks before they expire, you can imagine the kind of effort it takes. We have not complained in the past about all of the challenges that comes with the reason why they bring some of these vaccines to Nigeria is because Nigeria has the population to absorb the vaccines, and they also know that Nigeria has the capacity to absorb these vaccines. So imagine if Nigeria had not stepped up, if the Presidential Steering Committee, the Federal Ministry of Health and NPHCDA had not stepped up to collect these vaccines and vaccinate. Over 10 million doses of the vaccines that we have utilized in Nigeria would have wasted. So the vaccines that got expired were of the AstraZeneca type, right? And these ones arrived in Nigeria around 5-6 weeks before expiration. Despite the best efforts of the health workers working around the clock to get them into the arms, it was not possible because health workers provide health services. They don't actually do magic, right? It will have been magical for them to do anything beyond what they have done. So we appreciate and acknowledge the work that the health workers have done. In terms of the impact on the COVID-19 immunization program, we do not expect it to have a negative impact. Immediately, we recognized that the vaccines were going to expire. We withdrew them from the field, and we've withdrawn them with the aim of destroying them. This is a normal practice. This is why we did not make a lot of noise about it. We had the option, of course, just like the Honorable Minister of Health has communicated, of extending these vaccines by 3 months. This is standard practice, and I'm sure that even the layman is aware of this. But because of the high and rigorous standards that we have placed on vaccines and other medicals in Nigeria, we refuse to take that option of extending the expiry date. Immediately it was time, we withdrew them and we will destroy them. We know that Nigeria has scarce resources, but our resources are not so scarce that we will begin to extend expiry date. We hold the issue of vaccination to the highest degree, and we will continue to ensure that only potent and safe vaccines will be given to Nigerians. This is something that we hold very true. We see this as our moral responsibility, and we discharge it with the highest level of responsibility.